How safe is eyelid ptosis correction? What are the risks?
Correction for eyelid ptosis or drooping eyelids requires specialized surgery typically performed by an oculofacial plastic surgeon. An oculofacial or oculoplastic surgeon is someone who is first trained in ophthalmology before receiving postgraduate fellowship training in plastic surgery of the eyes and face. This type of training is not typical in a general plastic surgery residency. As an oculofacial plastic surgeon with over 30 years of experience, I'll share some insights into how I guide my patients who have eyelid ptosis. In my experience, most people who have ptosis are aware that their eyes appear smaller, and they assume that their ptosis is there because of excess skin weighing down over their eyes. Unfortunately, addressing the hooded skin over the eyes alone does not always improve how well the eyes are opening, leaving individual frustrated by still having a tired appearance after undergoing conventionally performed upper eyelid surgery. Proper diagnosis is critical. This means performing measurements as well as simply elevating the hooded skin over the eyes to observe if the eyelids continue or remain to be drooping. The most common cause of ptosis is related to a deeper muscle in the eyelid called the levator muscle, like the word elevator without the first letter E. Although mild cases of eyelid ptosis may be temporarily improved with an eye drop, the most definitive solution is surgery. The type of surgery I recommend depends on the degree of ptosis and the strength of the levator muscle, in addition to any other ocular conditions which I also evaluate during my examination. There are several approaches to ptosis correction, such as Mueller's muscle resection for milder cases, which I perform from behind the eyelid. I perform this procedure a lot for people of all ages who consult me for cosmetic upper eyelid surgery or blepharoplasty. By addressing excess skin and fat, as well as eyelid ptosis, your eyes look brighter and your expression appears to be more confident and energetic. Another procedure I routinely perform is levator muscle advancement or levator muscle resection, which involves access from the front of the eyelid in situations where the eyelid needs more elevation than can be achieved from the approach done behind the eyelid. For people who have more severe eyelid ptosis and little levator muscle function, I perform a procedure called a frontalis sling. This procedure involves creating a connection between the eyelid and the forehead muscle, which is then able to directly lift the eyelid. As with any surgery, there are some risks. The eyelid may open too much. Also, it may not open enough. In procedures such as levator muscle advancement or resection, I have patients during surgery sit up to assess the eyelid position under normal gravity. This allows for immediate adjustments if needed. Occasional enhancements are indicated, and in my practice, since I have my own office operating facilities, I can perform enhancements when appropriate, and this makes it convenient for my patients in comparison to surgery centers or hospitals. If you're experiencing drooping eyelids, Just remember that there may be more than just extra skin responsible for your appearance. Eyelid surgery is an art that begins with proper diagnosis. Expertise and experience with ptosis surgery is critical for a successful result. I hope this information from my experience helped you. If you're interested in recommendations for your individual situation, you may contact us through our websites or call our offices to schedule a consultation. Thank you.